Right, and as Ellie has explained, although I'm speaking for Keep Our NHS Public tonight, I am Vice Chair of London and Eastern Region of Unite, and I'm very proud of the resources that my union has put into the fight for the National Health Service. Now to ask the question, how have we arrived at a position where the big private healthcare companies can now dictate to every individual throughout the UK what kind of healthcare we can have? It's the result of more than 2 decades of lobbying and active interventions by the private healthcare companies to both Tory and Labour governments. It arises out of a rotten political system involving an array of corrupt politicians from all the parties who voted in Parliament over 21 years for the privatisation of healthcare services. And their reward has come through personal investments in the private healthcare companies and lucrative jobs once their political careers are over. 220 of the parliamentarians of all parties who voted on the Health and Social Care Act had shares in private healthcare companies. The parliamentary system itself is corrupt because after declaring their interests, there's nothing to stop politicians voting for their own personal profit. The Health and Social Care Act itself was provided to the politicians by the American private consultancy firm McKinsey. Partners in McKinsey and other McKinsey staff regularly take senior jobs inside government. A former senior partner became Chief of Policy and Strategy for Tony Blair from 2005 to 2007, and is now Chairman and Acting Chief Executive of Monitor, which regulates the new healthcare market and plays a crucial role in offering NHS business to private companies. McKinsey now uses its inside knowledge to advise private companies on how to break into the healthcare market. It's also offering advice on commissioning to the clinical commissioning groups, which are now buying local NHS services. Although some local CCGs have taken a stand against privatisation, like ours in City and Hackney, recent surveys show that 1 in 3 GPs running the new CCGs also help run or hold shares in private healthcare firms. The Competition Commission was forced to step in a couple of weeks ago because 3 major private healthcare companies have been overcharging for their services to the tune of £200 million a year. 1 in 3 of the 276,000 patients a year treated by one of the companies is funded by the NHS. That's 1 in 3 now. 6 years ago, it was just 3%. During the passing of the Health and Social Care Act, futile attempts were made to ensure greater financial scrutiny of private healthcare companies. Efforts were also made to enshrine the care of patients above the payment of creditors in the event of firms failing. This was laughed out of court by the private healthcare companies, who said no bank would lend to an entity that prioritised human beings over repayment of debt. These are the very same banks we bailed out in 2008. Parallel to and assisting in the avalanche of privatisation is the slashing of funding to the NHS by £20 billion by next year and by another £20 billion by 2018. And the McKinsey consultancy also had a hand in this, in drawing up that plan. The internal market forced on the NHS over the last 21 years has pushed up administration costs from 6% in 1979 to 12% at the last reckoning, and some academics estimate them now to 20%. The resulting cuts are stretching NHS services to the breaking point. This is accompanied by a continuous barrage of propaganda against the NHS by pointing out the inevitable disastrous failings of care, like the scandal of the Mid Staffordshire Trust. The private company's 20-year strategy is virtually accomplished, an inadequate, under-resourced state medical system picking up the complicated and expensive cases of the poor, running alongside a lucrative private healthcare system producing profits for shareholders, which is for the better off. I would ask all those with any connections to the Labor Party to demand it puts into its manifesto a commitment to eliminate the market from the NHS and to reinstate responsibility for the Secretary of State for the Health Service. If it is not willing to do this, it should step aside in favour of a party that will. I would also ask all of you who have not yet committed to come to sign up for the TUC-sponsored demonstration on the NHS at the Tory conference in Manchester to demand they take their corrupt and money-grubbing hands off the NHS.
Thank you for that depressing. Does anybody have any questions? Yeah, the gentleman there.
I think to make matters worse, more depressing, the US and EU trade agreement would consolidate the whole changes and force government not to interfere with the privatization of health services, also education services. Do you have any comments on that?
Well, I think it's part of the whole the whole trend and the whole strategy, which is, it's a multifaceted attack on the public services and the welfare state, and it's coming from the government, it's coming from the media, it's coming from these private healthcare companies, it's coming from all sides, and the aim is to break up our public services and our welfare state, and that's why I'm saying that we have to ask the Labor Party to declare that it is going to stand up for the NHS and that it is going to reverse this privatisation and that it's going to renationalise the NHS. And if it's not willing to do that, and so far I haven't seen much sign that it is, then we should be asking that party to stand aside in favour of a party that represents all of us and that stands up for our public services and the welfare state, and we should be looking towards building that party. I know there's all kinds of aspects of the NHS campaign that we can get involved in, which is lobbying the CCGs and joining our patient participation groups and holding public meetings to inform people about the situation, exposing the role of the private healthcare companies. But really we have to have a national strategy to tackle this, and of course not only the NHS, but all of our welfare state has got to be defended.
Is this on?